Hello and welcome to Health Matters. I'm Christy Fleshman.
And I'm Michael McInerney. In this show, we'll be looking at ways to be more attuned to health issues, make healthy lifestyle choices, and of course, provide tips on improving your health.
May is recognized as National Physical Fitness and Sports Month, Mental Health Awareness Month, and National Women's Health Week is May 14th through May 20th.
Plus, we'll check in with our friends at eatright.org to see what's cooking this month.
During the month of May, the Office of Disease Prevention and Health Promotion celebrates National Physical Fitness and Sports Month to raise awareness about the benefits of physical activity. Encourage people to get active using their Move Your Way resources.
Get to know the Move Your Way campaign. People in our communities need physical activity to be healthy. And the Physical Activity Guidelines for Americans clearly states how much activity people need based on the latest science. But most people still aren't getting enough. And that's where Move Your Way comes in. Move Your Way is a national campaign launched by the U.S. Department of Health and Human Services to help Americans get active. The Move Your Way campaign adapts the physical activity guidelines into information everyone can understand and use, no matter their age, abilities, health status, or fitness level. Move Your Way aims to reach people who aren't active enough yet, but who are thinking of making a change. And to reach them, Move Your Way is changing the conversation about physical activity. Being active has great health benefits, but for many people, getting active isn't easy. They're surrounded by messages that make physical activity feel unachievable, overwhelming, and all or nothing. Move Your Way shows how manageable and adaptable physical activity can be, and how to work around barriers like lack of time or access to facilities. Move Your Way means lots of things count as physical activity, even everyday tasks like cleaning your house and walking your dog. It all adds up. Even a few minutes of moving more each day has real benefits. Find activities that work for you, so it's easier to stick with them. Move Your Way is ready to use with a suite of fact sheets, posters, videos, and interactive tools tailored to different audiences like older adults, parents, kids, teens, and pregnant and postpartum people, and based on people's needs. Move Your Way materials are tested with diverse groups of people to make sure they're clear, informative, and accessible. And all materials are available in English and Spanish. It can be hard for people to get active on their own, and that's where you come in. Community organizations like health departments and nonprofits can use Move Your Way to help their communities get active. You can make Move Your Way work for your community, whether that means starting a brand new local initiative or using Move Your Way materials in your existing activity programs. Do it your way. Plan events, big or small, that makes sense for your location. Use Move Your Way's ready-made materials or adapt them for your community. Post Move Your Way's grab-and-go social media messages and graphics. Or start your own social media challenge. And you don't have to start from scratch. 10 communities across the U.S. tested out Move Your Way with events, new programs, and social media messages to get people in the community moving. Their experiences helped inform a community playbook with tips and materials to help communities of any size, location, or budget promote physical activity. The playbook has resources to help you do things like plan community events, build a budget, work with local schools and businesses. Everything you might need to bring Move Your Way to your community. You can find the playbook on health.gov as part of the Move Your Way Community Resources website. Here's how 3 community partners describe their experience with Move Your Way.
Move Your Way is really key to Active Southern West Virginia's health education efforts. It gives us a way to interact with our audience online and through partnerships. We use the community playbook to identify partners and work with them on a health education campaign. For example, we partnered with a local library in a small West Virginia town to add an obstacle course to their bookmobile program, and then to distribute the Move Your Way fact sheets for kids. Now kids can get their dose of physical activity when they come to get books and use the free Wi-Fi.
Before Move Your Way, the Siouxland District Health Department used different campaigns, curricula, and programs at the same time. Having one message has made our work easier and more impactful in the community. People now see Move Your Way and know what it's all about. For example, we partner with local healthcare providers and clinics to reach pregnant and postpartum people. We distributed over 2,000 bags with Move Your Way fact sheets and goodies to expectant parents in our area.
The Move Your Way resources were easy to adapt for our organization's needs. The Southern Nevada Health District serves just over 2 million residents, many of them native Spanish speakers. We were able to pick and choose what we needed and find fresh ideas to reach our communities with voices they trust and are ready to engage with.
Now it's your turn to move your way and get your community moving too. Find all the Move Your Way resources at health.gov/moveyourway/community resources.
Health.gov also provides you with an activity planner. This planner can help you to set goals, choose activities you want to do, and get tips to help you stay motivated. When you're done, print your plan to track activity throughout the week in your journey to a healthier you.
May is also National Physical Fitness and Sports Month, which means it's a great time to support youth sports participation using the National Youth Sports Strategy. Take a look.
Move your way. When kids play sports, they're not just getting a workout. They're learning the skills they need to succeed in life. They learn to try and try again. They learn to keep their focus. They learn to work as a team. And they learn to take the lead. And when the game ends, they take those skills with them. Work ethic. Focus. Teamwork. And leadership. Sports help kids succeed on and off the field. And there's a sport out there for everyone. To help kids find their own way to play, check out health.gov/moveyourway.
Don't forget to check out these Healthy People 2030 physical activity evidence-based resources. You can implement these activities in your community. There are 29 evidence-based resources related to physical activity.
Lastly, share the list of My Health Finder tips to help people live healthier lives through increased physical activity, such as aiming for a healthy weight, staying active during pregnancy, and staying active with a disability.
We have to take a break. When we come back, we'll be talking about May being Mental Health Awareness Month. Don't go away.
Welcome back to Health Matters. I'm Michael McInerney.
And I'm Christy Fleshman. Health Matters is a show where we look at ways we can all make better choices that will benefit us. For example, May is Mental Health Awareness Month, and the Substance Abuse and Mental Health Services Administration has a short video to help get the word out.
Hello, I'm Dr. Miriam Delphin-Rittman, Assistant Secretary for Mental Health and Substance Use in the U.S. Department of Health and Human Services. May is Mental Health Awareness Month, a time when the nation comes together to help spread the word about the vital role mental health plays in our overall well-being. At SAMHSA, we remain fully committed to increasing access to mental health services and supports across the country. We want everyone to know that people with mental health conditions can experience recovery and live full, whole, meaningful lives. And we can all play active roles in caring for our mental health. Practicing self-care, asking for help when needed, and checking in with ourselves and people around us all can make a difference. If you're looking for services in your community, visit our online resource at findtreatment.gov. Or if you or someone you know is in crisis, call or text 988 or chat 988lifeline.org for help 24 hours a day, 7 days a week.
Mental Health Awareness Month was established in 1949 to increase awareness of the importance of mental health and wellness in Americans' lives, and to celebrate recovery from mental illness. For the past 20 years, the Substance Abuse and Mental Health Services Administration has recognized Mental Health Awareness Month every May to increase awareness about the vital role mental health plays in our overall health and well-being.
When it comes to mental health, small actions can equal big impacts. If you're worried about your mental health or you're worried about someone you know, there are resources and people out there who are willing to help, no matter what your situation is. Talking about mental health helps promote acceptance and encourages people to seek help. Whether we share resources, encourage others to seek help, or simply are there for someone when they need us, we instill hope and can help to reach out when they need us most.
Self-care is important for your mental health. Despite life stressors, there are many things you can do to maintain positive mental health, including self-care. Mental health is essential to your overall health and quality of life. When you take care of yourself, your physical and emotional health improves. You become more resilient and can find ways to manage stress in a healthy and positive way. Taking care of yourself is an essential part of your mental health.
We all play a part in one another's mental wellness, and language matters. The language we use to talk about mental health can either perpetuate prejudice and discrimination or promote acceptance and compassion. So when it comes to mental health, words do matter. It's up to each of us to be a lifeline, sharing in a commitment to care for ourselves and for those around us. When we use open and compassionate language around mental health issues, we empower ourselves and encourage others to find the help they need.
Let's support each other and make it okay to reach out and seek help whenever we need it. Be aware of the signs and symptoms of mental health issues so that we can all work together to support one another. If you're worried about your mental health or are worried about someone you know, there are resources and people out there who are willing to help, no matter what your situation is.
So no matter the situation, there's always help and there's always hope. The Substance Abuse and Mental Health Services Administration wants to inform people about the importance of mental health across the nation. They also want to make people aware of their 988 Suicide and Crisis Lifeline, which can be used for those who need mental health-related crisis support. The 988 Lifeline is a national network of local crisis centers that provides free and confidential emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week in the United States. They're committed to improving crisis services and advancing suicide prevention by empowering individuals, advancing professional best practices, and building awareness.
Healthy People 2030 also has a list of evidence-based resources you can share with your networks to help develop mental health programs or policies. This list contains over 30 evidence-based resources you can share with your friends, family, and community.
You can also share these My Health Finder resources on mental health and relationships. It can help you create healthy relationships, help you help a loved one, and provide guidance on general mental health issues.
I know it's a lot to take in, If you have any questions, please feel free to visit health.gov or samhsa.gov/find-help or simply call 988.
Well, we have to take a break, but when we come back, we'll learn about Women's Health Week in May. See you after the break.
Hello, and welcome back to Health Matters. I'm Christy Fleshman.
And I'm Michael McInerney.
The Office on Women's Health celebrates National Women's Health Week from May 14th to the 20th as an opportunity to encourage women and girls to prioritize their health and well-being. The Office on Women's Health achieves its mission through a wide range of programs and activities. The office also leads several groups and committees to coordinate efforts for women's health within the U.S., Department of Health and Human Services, as well as other federal agencies. The foundation of good health is the same no matter your age. Eat healthy, be active, go to the doctor or nurse for regular checkups, take care of your mental health, and don't take unnecessary risks like texting while driving. Whether you're in your 20s or 90s, they've got you covered. Visit womenshealth.gov/healthyliving-age. Choose your decade to find out what steps you can take for good health. Healthy living in your 20s, healthy living in your 30s, healthy living in your 40s, healthy living in your 50s, healthy living in your 60s, healthy living in your 70s, healthy living in your 80s, and healthy living in your 90s. Be sure to share their My Health Finder resources on women's health, like getting an annual Well Woman visit. Schedule a Well Woman visit with your doctor or nurse every year. The Well Woman visit is an important way to help you stay healthy. Well Woman visits include a full checkup, separate from any other visit for sickness or injury. These visits focus on preventative care for women, which may include services like vaccines, shots that improve your health by preventing diseases and other health problems, screening tests, which are medical tests to check for diseases early when they may be easiest to treat, education and counseling to help you make informed health decisions. What happens during a Well Woman visit? Your Well Woman visit is a chance to focus on your overall health and wellness. There are 3 main goals for the visit: documenting your healthy habits and history, getting a physical exam, and setting health goals.
It's also important to understand how to manage stress. You know, not all stress is bad, but long-term stress can lead to health problems. So preventing and managing long-term stress can lower your risk for other conditions like heart disease, obesity, high blood pressure, and depression. So you can prevent or reduce stress by planning ahead, deciding which tasks to do first, and preparing for stressful events. Remember, some stress is going to be hard to avoid. You can find ways to manage stress by noticing when you feel stressed, taking the time to relax, getting active, and eating healthy, finding solutions to your problems you're having, and talking with friends and family.
A key strategy is getting regular physical activity. Regular physical activity is good for everyone's health. Physical activity is anything that gets your body moving. Aim for at least 150 minutes of moderate intensity aerobic activity each week. And at least 2 days a week, do activities that strengthen your muscles. If you haven't been active before or you haven't been active in a while, start slowly. Even 5 minutes of physical activity has real health benefits. Once you get the hang of it, add a little more activity each time.
You can also share this dietary guidelines fact sheet to encourage pregnant or postpartum people to build a healthy eating routine.
Don't forget to also explore Healthy People 2030 objectives focused on improving women's health. Women experience many unique health issues. For example, pregnancy, childbirth, and menopause. And some health issues that affect both men and women pose unique challenges for women. Healthy People 2030 focuses on addressing these specific needs in order to improve women's health and safety throughout their lives. Both pregnancy and childbirth can lead to serious long-term health problems for women. Strategies to decrease unplanned pregnancies and make sure women get high-quality health care before, during, and after pregnancy can help reduce serious health problems and deaths. Women are also at risk for diseases like breast and cervical cancer. Screening for these diseases and health issues that disproportionately affect women is key to identifying problems and making sure women get the treatment they need.
So before we go, I promised you a visit from our friends at eatright.org. Well, here it is.
Hi, I'm Wesley Delridge, registered dietitian nutritionist with Kids Eat Right. Today we're going to make a budget-friendly recipe that's great for families. These creamy squares can be served as a side or a snack. We've already washed our hands, so let's get started. We'll preheat the oven to 350 degrees Fahrenheit and mist a 13 by 9 inch baking dish with non-stick cooking spray. Thaw 20 ounces of frozen chopped spinach and empty it into a colander over the sink. Press down to squeeze out the excess water. In a large bowl, whisk 3 eggs and a cup of fat-free milk. Slowly stir in a teaspoon of baking powder and a cup of white whole wheat flour. This is different from refined flour, so be sure to read the label. Look for words like 100% whole grain or whole wheat. Add the spinach, a half cup of grated Parmesan cheese, and 6 ounces of shredded Monterey Jack cheese. Mix it thoroughly. Spread the mixture evenly into the baking dish and place it in the oven for about 35 minutes or until it's firm and the edges are golden brown. Let it cool for 20 minutes before slicing into squares and serving. For more kid-friendly recipes, visit Kids Eat Right at eatright.org.
Unfortunately, that's all we have time for this month. If you found these tips helpful and if you want more information, check out health.gov or go to the American Heart Association at heart.org and samhsa.gov. And be sure to check out eatright.org. I'm hungry now, and my name is Christy Fletcher.
And I'm Michael McInerney, and we will see you here next time on Health Matters.